The Ohio House passed legislation that will require insurance companies to provide the same coverage for chemotherapy pills as for traditional IV treatments. The pills are more effective and less risky, but have high monthly co-payments.
And so the whole idea of being home and getting to take a pill and not losing hair, all of that was like, wow, this is like, we finally have met the generation where, it's improved a lot since my first cancer. The nurse says, we can get it for you, but your copay for 14 days supply will be $2,000 and you need 28 days supply. So you need $4,000 copay just for this drug. At a time when you're on disability, you don't even bring in $4,000. So $4,000 going out for that is but you still have copay for the doctor, you have copay for the shots, you have copay for the other things that you do.
A similar bill is on the table in Wisconsin at the moment.
It was an issue that struck a raw nerve with the public. We begin with the remarkable reversal of fortune for legislation that would make expensive chemotherapy pills more affordable for cancer patients. Only a week ago, it looked like this bill might be dead. Now it appears it'll soon become law.
According to the Milwaukee Journal Sentinel, 29 states have already passed a law prohibiting the extremely high co-payments for chemotherapy pills. But what makes these pills so expensive for insurance companies? It's hard to say since pharmaceutical companies don't reveal their pricing strategies. According to the Slate, drugs like Erbitux, which is used to treat colon cancer, are only slightly more expensive in production than most pills. Production costs amount to a few dollars a dose at most. What makes these pills so expensive is simply that drug companies can charge whatever they want. The National Bureau of Economic Research points out that the US pharmaceutical market is currently the only market in the world where drug prices remain largely unregulated. In every other major market, governments regulate drug prices.
I have diabetes and some of my medicine is very expensive. Why is the same medication that I use cost so much less in Mexico or Canada, even though it's being made right here in the United States? We as a country need to fix this problem.
Well, the main reason is that Canada, Mexico, their governments are bulk purchasers of these drugs. And so they negotiate much cheaper prices with the drug companies. We still don't do that. And I actually think it's something we should do.
The US spends a lot more than any country in the world on overall healthcare expenditures. According to the New York Times, the US spends about 18% of its GOP on healthcare. That's almost double the spending of most other developed countries.
All right, so you've probably heard that the reason people enjoy quote-unquote free healthcare in Australia and the UK and Canada, etc., is that they pay higher taxes. That money then goes into a big pot and is used to pay for people's healthcare. But in fact, in the United States, we spend more tax money per capita on healthcare than Germany, Australia, the United Kingdom, or Canada.
Government-funded programs such as Medicare and Medicaid receive discounts on drug prices. That's a quick look at drug price regulation. I'm Julia Rabe.